What if the reason your GERD won't go away isn't acid at all? Yeah, I know. That sounds like saying rain isn't caused by clouds, which feels almost ridiculous at first. But stick with me for a second, because if acid were the only problem, medication would usually fix it. Yet, a lot of people are still dealing with reflux even after treatment. And that's where things start to get interesting. That gap between what you've been told and what you're experiencing is exactly what we're going to unpack. And no, it's not because your body is broken. And it's definitely not because you're doing something wrong. It's because the explanation you've been given is incomplete. Incomplete explanations lead to incomplete results. We've been told GERD is about too much stomach acid. So naturally, the solution sounds simple. Reduce the acid and the problem goes away, right? But if that were the full story, GERD wouldn't be one of the most persistent, frustrating conditions people deal with. Here's the part most people never hear. And once you hear it, things start to click in a completely different way. GERD is not just a chemistry problem, even though that's how it's usually presented. It's also a physics problem, which means it has to do with pressure, positioning, and mechanics inside your body. And medicine is really good at treating chemistry because you can package that into a pill. But physics is a lot harder to simplify in a prescription. My name is Marcus. I'm a research scientist with over 25 years of experience, and I'm the wellness watchdog, and you're watching Health Sense or Nonsense. I spent hours digging through clinical studies, research papers, and medical data so you don't have to. I translate it into plain English so it actually makes sense. In this video, you're going to understand what might actually be causing your reflux, how to recognize the signs, and what you should do differently starting today. And more importantly, you'll stop guessing and start understanding. Let's start with what you've probably been told, because this is where things begin to go sideways for most people. GERD is usually explained as too much acid irritating your esophagus, which sounds logical on the surface. That explanation isn't wrong, but it's incomplete. And that missing piece is exactly why so many people stay stuck for years. And when you only focus on acid, you ignore everything else that controls where that acid goes. Quick but important note before we go deeper, because I want to keep this grounded and responsible. This video is for educational purposes only and is not medical advice. And it's important to talk to your healthcare provider before starting or stopping any treatment. My goal here is to help you understand what might be happening, not replace professional care. Everything I'm sharing here comes from published research and clinical guidelines, but how it applies to you depends on your specific situation and your doctor's evaluation. Now that we've got that out of the way, let's keep going. Think of your stomach like a balloon and your esophagus like a tube connected to it, because that visual actually helps this make sense. At that connection point is a valve called the lower esophageal sphincter, and its job is to keep everything in your stomach unless you're swallowing. When that valve is working properly, reflux doesn't happen, even if your stomach is producing acid normally. So the real question becomes not just how much acid you have, but where that acid is going. Now imagine that valve isn't sitting where it's supposed to anymore. And this is where things get interesting. That's what happens when something called a hiatal hernia, which is common, especially in people with chronic GERD, and it's one important, often under-discussed reason symptoms can persist. A hiatal hernia is when part of your stomach pushes through your diaphragm and slightly into your chest cavity. Not dramatically, not like something you notice instantly, but just enough to disrupt how things function. That small shift is like bending a door hinge just a little bit, and this analogy really matters. The door still looks normal, and from the outside everything seems to be fine, but now it doesn't close properly. That door is your valve, and when it doesn't close correctly, stomach contents don't stay where they belong. They move upward. And that's what you feel as reflux. Notice what just happened there, because this is a key insight. For many people, the issue just isn't how much acid you make, it's that the acid has easier access to your esophagus. That's not purely a chemistry issue, that's also a positioning issue. And once you understand that, the entire strategy for fixing it starts to change. This is where I start to get a little skeptical about how GERD is usually explained. And honestly, this is the wellness watchdog part of me coming out. We've turned GERD into a purely chemical problem. And that's convenient because chemical problems have pharmaceutical solutions. You take a pill, reduce acid, and it feels like something is being done. But your body isn't just chemistry, it's mechanics too. And ignoring that leads to incomplete solutions. It's a bit like putting noise-canceling headphones on while your car engine is on fire, which sounds dramatic, but actually fits. Things get quieter. Symptoms might feel better, but the underlying issue hasn't been addressed. And that's why some people end up taking medication for years without actually resolving the problem. They're managing symptoms instead of fixing the cause. Now, to be fair, and this part matters, acid-reducing medications absolutely have their place. They can reduce irritation, help healing, and make symptoms more manageable in the short term. But if your GERD keeps coming back or never fully goes away, that's your signal that something else is involved. And a hiatal hernia is one possible piece of that puzzle. Not the only one. Here are some clues that a hiatal hernia might be part of the picture. And these are things you can actually observe in your daily life. If your symptoms get worse when you lie down, bend over, or eat a large meal, that's not random. That's pressure and positioning showing up in real time. Your body is basically giving you feedback about what's happening mechanically. If medication only partially helps, that's another important clue that often gets overlooked. Because if acid were the only issue, reducing acid should solve it completely. When it doesn't, you're likely dealing with more than just chemistry. And that's when you need to shift your approach. Now, this is where things start to change. And this is the part most people never hear. Instead of asking, how do I reduce acid? You start asking, how do I reduce pressure and improve positioning? That one shift might sound small, but it completely changes how you approach GERD. And it opens the door to solutions that actually make sense. Quick pause here, because if this is helping you see your GERD differently, hit like and subscribe so more people can actually find this kind of information. It helps the channel reach people who are stuck in the same cycle and need a clearer explanation. And honestly, that's the whole point of this channel. Meal size matters more than people realize. And this is one of the easiest places to start. Large meals increase pressure inside your stomach, and that pressure pushes against a weakened valve. Smaller meals reduce that pressure, which makes reflux less likely. That's not a diet trick. That's basic physics applied to your body. Timing matters too, especially in the evening when most people struggle the most. Lying down right after eating removes gravity from the equation, and combined data from multiple studies show that avoiding food close to bedtime and elevating the head of the bed can reduce nighttime reflux. When you take gravity out of the equation, reflux becomes much easier. Body position is another factor that people underestimate, but once you understand it, you can't ignore it. Elevating the head of your bed slightly can reduce nighttime symptoms, but stacking pillows doesn't really work the way people think it does. That just bends your body in awkward ways and usually leads to neck pain. Now, here's the part most people don't want to hear, but it's where real progress actually happens. Some of the habits you think are helping might actually be making things worse, at least for some people. And once you start paying attention to patterns, you can see what actually applies to you. For example, constantly sipping water throughout the day sounds like a healthy habit, right? And in many cases, it is. But if you're frequently filling your stomach or taking in large volumes, that can increase internal pressure and potentially trigger symptoms in some people. It's not just what you eat, it's how often you stretch your stomach. Another common trap is what I call the safe food mindset. People eliminate everything acidic, spicy, or flavorful and end up eating in a very restricted way. But reflux isn't just about irritation. It's also about movement in the wrong direction, and both factors matter. That's why people feel stuck. They're doing everything right, and they're still not getting better. The issue isn't you, it's that you may be missing part of the picture. Now, before we wrap this up, here's another important reminder, because this part matters just as much as everything else we've talked about. If you're dealing with moderate or severe GERD or symptoms that aren't improving, This is where working with your doctor is essential. Some people require long-term treatment to prevent complications, and decisions about medications should always be made with your personal healthcare provider, not from a YouTube video. Your goal here is better understanding, not replacing medical care. Let's talk about diagnosis so you know what to do next instead of guessing. Hiatal hernias are usually identified through imaging like endoscopy or a barium swallow study. These allow doctors to actually see what's happening structurally, but not all hernias are obvious and not all are caught right away. That's why this isn't about diagnosing yourself. It's about asking better questions and having better conversations. If your GERD is persistent, resistant, or just doesn't make sense, it's worth bringing this up. So here's what I want you to walk away with. GERD isn't always about too much acid. Sometimes it's about acid being in the wrong place. A hiatal hernia is one common, often under-discussed reason why GERD can persist, but it's not the only one. And if the problem is partly mechanical, your solution needs to include mechanical strategies. You have more control than you think once you understand what's really going on. Small changes in how you eat, move, and position your body can make a real difference. This isn't about perfection. It's about direction, because once you stop fighting the wrong battle, things finally start to change. I'm Marcus, the Wellness Watchdog, and this is Health Sense or Nonsense. And now you know what to do differently.